Hey, this is Dr. Garrett Harper at Graper Harper Cosmetic Surgery. We're going to talk about something that's not that sexy, and it's your preoperative kind of experience and what we need you to do to make sure that you get the best result. Probably the most common preoperative question we get is, do I need to be in my best shape prior to surgery? Or do I need to lose all my weight? What happens if I gain or lose weight after surgery? I'm planning on getting healthy, but when should we do this? And I tell every patient it's important not to put the cart before the horse. Every single patient should get in as good a shape as possible, right? If we do a tummy tuck or we do a breast surgery before you lose that 20 to 30 pounds, when you lose that weight, it can make your breasts less perky. It can make them less full. It can make the skin on your abdomen looser, meaning we didn't do as much as we could have had you lost the weight ahead of time. So it's paramount for you to get in as good a shape as possible. Now that means do it in a healthy way. Nobody needs to go on a split pea soup diet for 8 weeks and lose 20 pounds and have no protein and no nutrition, and then they can't heal their incisions. If you need for us to send you to somebody that we trust and is going to help you on your weight loss journey and get you in the best shape possible, we've got some amazing people that we've partnered with, and we're happy to send you to those people. But from a preoperative standpoint, the answer is yes. You need to get in as good a shape as possible prior to surgery. We're also going to make sure that our anesthetists take a look at all of your medications, and if any of them are going to interfere with anesthesia or interfere with your healing or make it a higher likelihood that you have a complication, we're going to have you stop those medications ahead of time. So that's why it's really important for you to make your preoperative appointment. We'll be able to go over all the instructions with you then. We'll also be able to go over your medication list and make sure that you're not on anything that could prevent you from having your surgery as scheduled. Don't smoke cigarettes. We really need you to be honest with us. If you smoke or if you vape or if you do anything that's nicotine related, it's going to cause your blood vessels to constrict, to get smaller. It's not going to be able to deliver that oxygen the way it needs to, and it can really interfere with your ability to heal. So we know that you want your surgery. We know this could be something that's life-changing and you've been waiting to do for years and years and years. But if we don't do the right things ahead of time, you're not only going to not get the best result possible, but you could potentially have a complication that makes things worse, and in an imperfect world could end up forcing you to have another surgery, which is not anything anyone wants. We've got to make sure that you're healthy. We've got to make sure you're not smoking. We've got to make sure that your primary care physician feels like safe and fine for you to undergo general anesthesia at our facility. So there's all sorts of requisites that we need to make sure are in line prior to your surgery to make sure that you not only have a safe surgery, but that you get the best possible result. Next to you, we're probably second in line for wanting you to get the most fantastic, life-changing result possible. So help us help you reach that goal. Thanks.